Welcome to Cognitia. This is where we break down complex ideas and explain how the world around us truly works. In December 2019, Chinese authorities reported a new virus spreading through local communities. In just a few months, it crossed borders, continents, and oceans. Cases doubled within days, and the world found itself facing a global pandemic. The virus responsible is called severe acute respiratory syndrome related coronavirus 2, or SARS-CoV-2. The disease it causes is known as COVID-19. Though most people simply call it coronavirus. So what actually happens when this virus infects a human body? And why did it change the world so dramatically? A virus is not really alive in the traditional sense. It is a tiny package of genetic material surrounded by proteins and a fatty outer layer. It has no way to reproduce on its own. To survive, it must invade a living cell and take control of it. Coronavirus spreads mainly through respiratory droplets. These droplets are released when an infected person coughs, sneezes, talks, or even breathes. The virus can also spread when someone touches contaminated surfaces and then touches their eyes, nose, or mouth. Once inside the body, the virus begins its journey deeper, targeting organs where it can multiply most efficiently. Its most dangerous destination is the lungs. The lungs are lined with billions of epithelial cells. These cells form a protective barrier between the outside world and the inside of the body. Coronavirus attaches to a specific receptor on the surface of these cells. Once attached, it injects its genetic material inside. The cell does not realize it has been hijacked. It follows the new instructions it receives. Those instructions are simple. Make copies of the virus. The cell becomes a factory, producing thousands of new viral particles. Eventually, the cell reaches its limit and self-destructs, releasing these new viruses into the surrounding tissue, where they go on to infect more cells. This process grows exponentially. Within about 10 days, millions of lung cells can be infected, and billions of viruses can fill the lungs. At this stage, the virus itself has not yet caused the worst damage. The real danger comes from the body's own defense system. The immune system is designed to protect us, but it must be carefully controlled. When coronavirus infects the lungs, immune cells flood into the area to fight it. Some of these immune cells also become infected, which disrupts communication within the immune system. Cells communicate using chemical messengers called cytokines. These signals coordinate nearly every immune response in the body. Coronavirus can cause infected immune cells to release far too many of these signals, triggering an uncontrolled reaction known as a cytokine storm. As a result, the immune system sends more cells than necessary into the lungs. Two types of immune cells cause the most damage. Neutrophils release powerful enzymes meant to destroy pathogens, but they also damage healthy lung tissue. Killer T cells normally eliminate infected cells in a controlled way, but in the confusion, they may begin destroying healthy cells as well. The more immune cells arrive, the more inflammation and tissue damage occurs. In severe cases, this damage becomes permanent, leaving lasting scars in the lungs and causing lifelong breathing problems. For most people, the immune system eventually regains control. It destroys infected cells, clears away the virus, and repairs the damage. These individuals experience mild to moderate symptoms and recover fully, but in severe cases, large portions of the lung's protective lining are destroyed. This allows bacteria that are normally harmless to infect the tiny air sacs where oxygen exchange occurs. Patients develop pneumonia. Breathing becomes extremely difficult or impossible without medical support, and ventilators may be required to keep them alive. After weeks of intense immune activity, the body becomes exhausted. If bacteria enter the bloodstream, the immune system can collapse entirely. When this happens, the risk of death rises sharply. COVID-19 is often compared to the flu, but this comparison is misleading. Coronavirus spreads more easily, infects more people, and leads to severe illness far more often than seasonal influenza. Pandemics can unfold in two very different ways. A fast pandemic spreads rapidly, infecting many people at the same time. This overwhelms hospitals, exhausts medical workers, and creates shortages of beds, oxygen, and ventilators. In such situations, some patients do not receive treatment in time, and deaths increase dramatically. A slow pandemic spreads the same number of cases over a longer period. This allows healthcare systems to function, patients to receive care, and researchers to develop treatments and vaccines. Slowing the spread saves lives. Before vaccines were available, humanity's main defense was behavior. Society itself became a kind of social vaccine. The most important goals are simple. Do not get infected and do not infect others. Hand washing is one of the most effective tools we have. Coronavirus is surrounded by a fatty outer layer. Soap breaks this layer apart, destroying the virus and washing it away. Washing your hands thoroughly and often dramatically reduces the risk of infection. Social distancing also plays a crucial role. Avoiding close contact, staying home when possible, and reducing gatherings protect both individuals and healthcare workers, who must remain on the front lines. Quarantines and travel restrictions are difficult, but they slow the spread of disease and buy time. Time for hospitals to prepare, time for researchers to work, and time for societies to adapt. How a pandemic ends depends largely on how it begins. Fast outbreaks end with unnecessary loss of life. Slower outbreaks give humanity a chance to respond wisely in the modern world. The outcome of a pandemic truly lies in our hands. Thank you for listening to Cognitia. Stay curious, stay informed, and we'll see you in the next exploration.